This video will demonstrate how to conduct a foot exam on patients with diabetes. This video is intended for the primary healthcare provider and identified office staff that may be responsible for conducting foot exams. The techniques that will be shown are based on the 2017 Standards of Medical Care in Diabetes. The Standards of Medical Care in Diabetes is revised annually by the Professional Practice Committee of the American Diabetes Association to provide evidence-based clinical practice recommendations. Foot ulcers and other lower limb complications secondary to diabetes are common, complex, and associated with increased morbidity and mortality. In addition, loss of protective sensation can render patients unable to recognize damage to their lower extremities. Strong evidence suggests that consistent provision of foot care services and preventive care can reduce amputations among patients with diabetes. However, routine foot exams are often difficult to incorporate into a busy primary care setting. The 2017 Standards of Medical Care in Diabetes recommend that all patients with diabetes should be assessed for peripheral neuropathy starting at diagnosis of type 2 diabetes and 5 years after the diagnosis of type 1 diabetes, and at least annually thereafter. The exam we will demonstrate consists of 3 components and should only take 3 minutes of the visit. You will find an annual comprehensive diabetes foot exam form that can be incorporated into your electronic health record in the resources that are available after this video. The Quality Payment Program Diabetes Foot Exam Measure looks at the percentage of patients aged 18 to 75 who've had this exam within the measurement year and must include documentation of the visual, monofilament, and pulse components. The 3 steps in a comprehensive annual foot exam should each take about 1 minute. These steps are: ask, renew the patient's diabetes history, look, complete the physical exam and the neurological exam, and teach, explain your findings, and teach proper foot care.
Good afternoon. We're here to learn about a diabetic foot exam, something which is so simple but can prevent illness and loss of limb. The foot exam has 3 different stages. First, we ask questions. Today, we have our Ms. Wood with us today to examine your feet. And I want to ask you a few questions about your diabetes. How often do you check your sugar?
Once a day.
And has it been high?
No, it's been normal.
Good. Have you been recording it?
No.
Okay, well, we need to work on recording so you can bring it in so that we can review it.
Okay.
Okay. Do you smoke?
No.
Have you had any sores on your feet that have failed to heal?
No.
That's good. Any other problems?
No.
Sounds good. Let's do your foot exam.
Okay.
First off, we're going to look to see if you have any discoloration, any calluses on your feet, any ulcers. Check between your toes. Make sure that there are no sores or cracks between the toes. Also going to look at your legs and look at your hair pattern to make sure that it is normal. We're going to also check your pulses to ensure that that is normal, you have adequate flow, and also your capillary refill. We expect the capillary refill to occur within 2 seconds of the time, which shows that you have good blood flow to your toes and your feet. Let's check sensation to your feet. And to do this, we're going to use a monofilament, which does not cause any pain. We're just going to touch it in several places on your feet to see if you have sensation.
Okay.
On the foot exam, we're going to check it on 2 places on the top and at least 5 on the bottom. But normally I'll check 3 on the toes, 3 on the ball, 2 in the middle foot, and 1 on the heel. So close your eyes and tell me if you can feel this.
Yes. 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 Yes.
Now also I want to apply just enough pressure to make the monofilament form a C. That's what we do. We'll check the other foot the same way.
Okay.
We also want to check vibration sensation. And to do this, we use a tuning fork. And I'm going to apply this to your bone, and you tell me when you no longer feel it.
No.
Okay, good. One thing, as we're here, we also look at your toenails, and notice that you do have some thickened toenails, but you have no ingrown toenails and no signs of infection. Okay. Let's also check your sensation as to movement of your feet. I'm going to move your toe. I want you to tell me if it's going up or down. And close your eyes. Okay.
Up, down, up, down, up, down.
Okay, great. So let's recap our exam today. Your exam was normal and looks very good. You still have your sensation to help protect your feet, but still you need to check your feet every day. You should look on the bottom to make certain that you don't have any breakdown, nails, tacks, anything at the bottom of your feet that you could not feel. You should also look for any sores on your feet or any open areas, and if you see any, please give me a call.
Okay.
You can apply lotion to your feet, but don't put any lotion between your toes. You should keep your feet dry. That's really important. And please continue checking your blood sugars on a daily basis, and bring your log in with you next time when you come so that we can review it.
Okay.
Now, do you have any questions?
No.
Okay,
Thank you very much.
Thank you. This 3-minute foot exam is very vital and important to the care of our diabetic patients. It is good to perform yearly so that we can ensure that our patients have good circulation and sensation to their feet in order to preserve their legs and feet. As we know today, our metrics and our HEDIS scores are quite important. One thing that we discovered in our office is that if we allowed the nurses to perform the exams at the time of workup, our metrics improved significantly. Thank you for joining us today. I hope this has been helpful. Have a good one.
The 2017 Standards of Medical Care in Diabetes issued a new recommendation on referring high-risk patients with a history of healed diabetic foot ulcers, partial foot amputations, or Charcot foot for specific therapeutic footwear to aid in the prevention of new or recurrent foot ulcers. The order must include the reason the therapeutic footwear is required. The 2017 standards also include specific recommendations for treatment of neuropathic pain. A list of resources and educational materials is available at the end of the video.